Good evening. Welcome to Left, Right and Centre. I'm Vishnu Shom. On the program tonight, India has the second highest number of COVID infections in the world recorded in the period of 24 hours. The government says it isn't because of the novel mutant strain reported. If not that, what exactly does account for this, given the fact that the lack of COVID-appropriate behaviour was always a reality? In a situation like this, we ask on our program tonight, should India start doorstep vaccinations in the worst hit areas? This has in fact been a suggestion which has been made. So why exactly are we asking all of this? So let's try and bring you a couple of details on why. Now let's take a look at these numbers that you see over here. These are the states with the highest positivity rate. What do we mean by positivity rate? Positivity rate refers to the percentage of people who test positive for COVID after doing an RT-PCR test or a rapid antigen test. And look at this number in Maharashtra. It is a whopping 23.4%. 23.4% of all those who do a test in Maharashtra test positive for COVID presently. Now, the numbers in Punjab are 8.8, which is also frightening. It's very, very high. But just look at the gap between 8.8 and 23.4. But let's give you an idea of some of the districts which are worst affected. The Pune district with 59,475 active cases is number one. It's the worst hit district presently in the country, followed by Mumbai, Nagpur, Thane. Delhi is being considered as one district, one area. Of course, there are several other districts as we know, but even in the national capital, the numbers are rising quite significantly. Now, one of the requests which has been made, and we'll look at this very closely on this program, should there be door-to-door vaccinations in Mumbai? Now, Iqbal Chahal, the Brain Mumbai Municipal Corporation chief, said, we requested the state to request the centre to allow us to do door-to-door vaccination. At the press conference today, Rajesh Bhushan, the Union Health Secretary, said, till date, we have not received any specific update about what you call door-to-door vaccination. He did say that it might be somewhat difficult, unrealistic in the Indian context, but that perhaps is because at the end of getting your jab, you need to wait for 30 minutes to see that you're okay. But in a situation like this, and given the fact that the centre has said it is important to surge vaccines in areas which have been very badly hit, perhaps there will be no option but to go for door-to-door vaccination. Well, joining us now, Dr. Shashank Joshi, member of the COVID Task Force in Maharashtra. We are also joined by Dr. Ram Vishwakarma, the advisor of CSIR and the chairman of the COVID Strategy Group of CSIR. Dr. T.P. Lahare, Director of Medical Education and Research in Maharashtra, joins us. And we'll also be joined by Dr. K.K. Talwar, advisor to the government of Punjab. Let me just go across to you, Dr. Shashank Joshi, first. You know, sir, today the DG of the ICMR quite clearly said that as far as that novel mutant strain in India is concerned, there is no data to back, assertions that is responsible for greater transmissibility in India, greater infections in India. So therefore, my question to you, sir, is this. Do you believe there is some other mutant strain active in, let's say, Maharashtra, which is responsible for this big spurt?
So right now, Vishnu, we are looking at investigating this matter in a scientific way. And the genomic labs of CSIR as well as Dr. Anurag Agarwal and the Maharashtra government are in close collaboration to do a collaborative study to prove or disprove this fact. So, and also at BJ Medical College, they have a high sequence genomic sequencer where they'll also look at this more critically and crucially. Whether it is home grain or not home grain, strategies don't change, Vishnu. Strategies will still be aggressive masking and COVID appropriate behavior and adherence to COVID protocols. And if they definitely need to be ramped up, there is no two ways about that. Yep. But one thing is sure that it is a rapidly transmissible strain. Now, whether it is the old strain, new strain, whether it's homegrown or international, we have no idea.
But you do maintain that this is a new strain which acts in a way different from the old strain, because you've said this repeatedly to us.
Correct. So clinically, definitely the disease is going into clusters and families and is rapidly transmissible. And at least the preliminary evidence suggests, or the clinical evidence suggests, that it appears to be more rapidly transmissible. But having said that, I think we need to prove it. So let us do more scientific data and analysis and prove or disprove this fact.
Dr. Vishwakarma, Are you satisfied with the number of gene sequencing cases that we've done at a time when we've got this huge rise in numbers in states like Maharashtra? Should we not have done a lot more sequencing to get to the bottom of what strain is responsible for this?
Yeah, so Vishnu, yes, the more and more sequences required, and as you know, I think several CSR laboratories, ICMR laboratories, other institutions are working tirelessly to do these sequences. This is a very specialized effort that requires, and sequencing alone is not enough. If you have sequences, it doesn't establish that it is causing faster disease or slower disease, causing this and that. This is the analysis. And that analysis, sequencing is only genomic data of the RNA sequence. But then you have to have clinical evidence, correlation of that variant, single mutant, double mutant with the clinical symptoms. So I think that work, I would say, work in progress. And we are continuously working on it. In fact, CSIR labs are working specifically in Punjab, Maharashtra, wherever requests are being made, and we are sequencing. And the central level INSA-COG program has been initiated only for this purpose. So several laboratories across the country are continuously sequencing, putting this data together, analyzing. But I must say that it's a very, very specialized job. Correlating sequence, just because we have a mutant doesn't mean that that mutant is related to particular disease or clusters that are appearing. But we will get to know, and we will soon know. But in the meantime, I think more and more sequences, I absolutely agree with you, and we are on the job.
So just so that we understand, how many sequencing machines do we have in this country?
Oh, they will be in hundreds or maybe 500 or 1,000.
And are these largely in a couple of select institutions? The reason I ask this question is because, as I understand it, sequences have to be flown to areas in many cases for tests to take place. That takes time. Therefore, I ask this question because should there not be sequencing personnel and sequencing machines available in all states, or almost all states?
So there are every state will have hundreds of these. Every biology lab these days is equipped with sequencing. This is a very, very common tool. But doing sequencing, having sufficient level of CT level, the sample that you are getting, because that sequence is linked with RT-PCR sampling that you are doing and collecting samples. So I think quality of the sequencing data, there are best of the lab in the country, and actually they're continuously doing sequences and depositing to international GSAC data bank. And we are also analyzing that. So it's a very, very, if you compare to many other countries, we are far ahead of doing our sequencing, and we are doing localized focused sequencing. It's not random sequencing. So if there is something happening in particular area, we ramp up that, like Kerala or Tamil Nadu, Maharashtra, and other states. So I think this is an ongoing effort. I must say, Department of Biotechnology, CSIR, All India Institute of Medical Sciences, IITs, everybody is putting their weight behind it. Virtually every biology lab and clinical lab in the country is involved in this enterprise directly or indirectly.
And yet the numbers of sequencing, it appears to be quite small. Since the last time when this was announced, how many more tests have there actually, how many more sequences have you actually done?
Oh, this would be running into maybe a couple of thousands or maybe more. Maybe now number maybe 10,000 plus or something, get in the whole country.
So statistically relevant. So what you're suggesting is that it is statistically relevant, that we don't need to increase the numbers per se.
Yeah, not dramatically. I'm saying this is not a RT-PCR test.
Understood.
This is very specialized information. You can go in random sequence. People, you will not get anything. What we need to do now is strategic sequencing. People who have got vaccination, single, double vaccination, getting infection again, those are our first target.
Right.
People who are in these clusters, random sampling in those clusters, Dr. Joshi and we have been discussing in CSIR, those are our targets. So there is a strategic sequencing that is required, not just show the number that I've got 100,000 sequences. That will not going to help you.
Sure.
And I think this is being done right now as we speak with major hospital in collaboration with all these institutions working together with Pune, Bombay, everywhere. So this is happening with the zero surveillance. Yeah.
Yeah. Thanks for clarifying that. Dr. Lahane, in terms of, from a clinical standpoint, the spurt in infections that you see now, is there any difference between what you see now and what you saw, say, a year back? Are people younger? Are they getting better sooner?
Yes. Now, if you see the infection now in the second wave, there is a shift. that the patients who are younger, that is 20 years to 40 years, are affected more. That is a floating population. Second thing is the families. The families are getting affected. It means the rate of infection is high as compared to the last wave. Secondly, as the Vishwakarma sir was saying about the sequencing, in Maharashtra also we are going to map the Maharashtra. In each and every district, I think we will do 100 tests, that is a 4,000 tests of the this one, and we will send 25 samples each week, and also the clinical data in that area, so that we will also map it. Is there any change in that? And also clinically we will correlate it. That
Dr. Lahane, when will all of this take place? The numbers now are staggering.
Numbers.
When will you be able to sequence every district or every area in Maharashtra?
Yes.
When?
We are going to sequence each and every district, that is all 36 districts, and also in Mumbai and Pune we will be sequencing at
when, sir?
4 districts.
When?
We are going to start from this week. Total April, this April month we are going to sequence it, and also in sequencing it is not easy, that we will have to send the RNA in -80° van. So that also we are organizing, and we are sending, after extracting RNA, we will send it to the NCCS, and this CSIR is going to help us.
Dr. Joshi, do you have any concern about the existing vaccines dealing with a potential new variant, strain, mutant, call it what you want? The virus has obviously evolved, that's natural, and clinically you are seeing it to be more transmissible. So the question remains, do the existing vaccines work as well? Sorry, Dr. Joshi, can you hear me? I think you muted your this thing. Go ahead, Dr. Joshi, yes.
So currently both the vaccines are reasonably safe, and at least Covaxin is very clear that it works against the mutant. They have data also which is published. So that I don't have any worry. As far as Covishield is also concerned, it works against the UK as well as the South African strain. So there is some data to suggest that some of that might work. But of course, this is work in progress, and every vaccine will evolve as the mutants will be coming out. And CSIR is in active collaboration. What Dr. Lahane is saying is very true, that every week, every district with a clinico-genomic correlation, they will try to see whether this correlate is true or false. And that will also lead us. And also people who have failed vaccine, they will also be genome sequenced. What is happening now, one more interesting feature, Vishnu, is if you do a rapid test on the day they go for a vaccine, many of them are turning positive, and the vaccine is getting the bad name. So I think it's important to recognize that many asymptomatic positives get the vaccine accidentally, and then we are blaming the vaccine. So also there, when we need to be very careful that in the peak of the pandemic, a lot of asymptomatics may be vaccinated, and therefore it may be wise idea that if you can afford, you do a rapid antigen test on the day you go for the vaccination. So if you are positive, then you don't need to take the vaccine and you need to get isolated. So that's something which we have observed, but it's all anecdotal reports. But that's something for us to also be mindful of.
No, that's an important point. And Dr. Vishwakarma, do you want to come in on that? Is there a real concern in a place like Mumbai, where we are trying to vaccinate as many people as possible, that a lot of people who are getting their tests are already asymptomatic, and therefore does the drug adversely affect them, or is it okay for them to be asymptomatic and still get the vaccine?
Yeah, I don't think any problem if they are asymptomatic, if they have infection. In fact, there should be priority to get in the vaccine, because the good thing about these vaccines which are approved globally are that they are protecting you from proceeding to serious situation.
Right.
That's so actually important. This is the best thing that is with the vaccines. And one thing I will tell you, that here I seriously think that we should now start doing clinical trial and validating the efficacy of these vaccines on pediatric population, 20%, 15% population in this country, which is actually the most asymptomatic, spreading virus to other people. So I think it's high time, when we think about universal vaccination, those people should be brought also in the ambit. And also we should be mindful that I think this complacency that had set up in last couple of months, we have to get out of this virus from the country as quickly as possible. More we delay, more we are providing virus opportunity to mutate and develop escape mutants. So that's my real worry.
All right. We're also going to be joined by Dr. K.K. Talwar, advisor to the Punjab government. But before I go across to Dr. Talwar, Dr. Lahari, let me ask you this. Door-to-door vaccination in the worst affected parts of Mumbai, does that make sense to you?
See, we are asking the central government that permit us for the door-to-door vaccination, not in Mumbai, but also where the districts are, we can say, more affected districts, and there we want that vaccination to ramp up. So once we ramp up the vaccination, our aim is that if they will get infected also, the disease will be mild. And so we are requesting for the door-to-door vaccination, because what happens, the patients are not coming. Secondly, the vaccination centers itself are the source of infection. And because of that, if you go door-to-door, that policy will be definitely useful to prevent this number of the cases, the serious cases.
Dr. Vishwakarma, your thoughts on that? One thought which a lot of people might have is you need to observe patients for 30 minutes. If you go door to door, how is that going to work?
Yeah, so I think this is a... Yeah,
go ahead, Dr. Vishwakarma.
Yeah, this is a logistic issue. It is also dependent on where you want to do door to door. Again, I emphasize that it is, if you start doing door to door randomly, then it may not have the direct effect. What is required is it should be backed with the data where the clusters are. And I think those people should be prioritized. And yes, it is a logistic problem to vaccinate people door to door. At this stage of the pandemic, I think maybe we have to wait a little bit more, and that situation may arise when we are really prepared with the logistics. And also we must realize that the resources that are available, because central level, there is a staggered vaccination program going on. How much supplies are going to those evenly distributed? So I think these are the issues the governments will have to decide. But scientifically, I say, yes, there are logistic issues, and the observational issue is one of the major problems, because if somebody develops some symptoms, then it is difficult to and it will also create a scare among people if something happens, which is not under medical support.
All right. We're also joined by Dr. K.K. Talwar, advisor to the Punjab government. Dr. Talwar, let's talk about some of the strains in Punjab. The last time we had you on the program, there were lots of UK strains, individuals with the UK strain who had been detected. And now in the latest genome sequencing, that number has gone up even further. So is that confirmed that the large majority of new patients have been affected by that UK strain in Punjab?
Well, thank you so much. Yes, I think 85% plus are UK strains with us. I mean, that is the analysis from about 800 samples that we have got the result. So obviously, I think UK strain is largely responsible for the present surge in Punjab.
Again, if that is the case in Punjab, I'm just trying to understand, Dr. Vishwakarma, why would that not potentially be the cause for the huge rise in numbers in Maharashtra? Is it because we just don't know, because we don't have the data on the UK strain in Maharashtra as yet? Because why would one state have one strain, very clear UK strain, they've done the tests, and yet for Maharashtra we just don't know?
Actually, the progression of the mutation that is happening in different localities will depend on kind of immune system the virus will encounter. So I think it is not necessarily what is in Punjab will happen, because our country is like a continent. If you look at the European situation, something different in France, something different in UK. But the mutation that are appearing in Maharashtra, particularly, they are under investigation. And unless there is a clinical correlation, I will not take too much about the sequencing and replacement of few sort of bases here and there and correlate directly, and I will not create the scaremongering. I will say let us wait for clinical evidence correlating with those mutants. Like, for example, the UK variant correlation with the clinical symptom is there. I think those things will have to come. So I cannot speculate on what kind of mutations are going on. Certainly, these are certainly the virus is spreading faster than the first phase.
Dr. Talwar, now that the centre has said that you can, or any state government can, really increase the pace of vaccination in areas where the virus has surged, what are you going to do in Punjab?
I think the vaccination drive is very seriously going on, and I think all kind of ways to vaccinate the larger number.
No, but specifically clustered areas where
Yes, I think like the big cities where we have the most infection. I think like in Mahallas there are being vaccinated. So I think there is a drive of vaccination. This seems to be the only way at the moment that we can really handle this kind of surge.
So, I mean, look, I mean, there may be concerns from a logistical standpoint on going door to door, but essentially, are you suggesting that there would be medical workers going out to localities and injecting people there?
Yeah, we have started in the with different wards and mohallas and finding a kind of a center where the medical team is there, and then the people who are in that area are brought. So this effort is going on for the last few days.
Could you tell us a little bit more about that, Dr. Talwar? Because this seems to be possibly a way forward in a country where there is vaccine hesitancy, or people are just too lazy to go, or people don't care about going. And then, of course, some people say that they're scared of the vaccine. Is this the way forward, what Punjab is doing? You're going to mohallas, going to areas.
Yeah, that's right. In bigger cities like Ludhiana, we had localized the mohallas. The medical team went there. There was a proper arrangement kept, and the people are joining area who are living there were brought there with the help of NGOs also. So, and though of course everybody has to wait for half an hour with all due precaution. So I think these are the, the number of vaccination number has certain, the last 1 week, if you look at it in Punjab, has gone quite high. As compared to
that's interesting.
That.
Dr.
So
Vishwakarma, any thoughts on that? If people aren't coming out to get vaccines, unfortunately, the government or healthcare providers will have to move in. Do you see that, we don't have to say door to door, but something of what is happening in Punjab, do you think that it's inevitable we do it elsewhere in the country?
I think the solution is more information, and I must point out here, globally now clinicians are reported for almost 2-3 months that there is something called long COVID. And in fact, this is something must go to people that, anybody who has this casual attitude that I will get virus, I will resolve, I'll take some treatment and I'll get resolved. No, your heart, your lung and your brain may likely to be damaged for the life. So this long COVID phenomena, I think this information should go to people that this is not only a cold infection that you are getting, you may compromise your vital organs for life. Part of your lung capacity may go. So I think yesterday you must have had the news from United States. They have allocated a very large fund to study a project called long COVID. So I think there are long-term consequences, and I think clinicians world over are reporting this. From the people who have died from this particular disease, there is a large data is coming out from several hospitals on biopsies that have been done on these people. So I think there are serious consequences on the way. So more information, like kind of programs that media you are doing, and more information is required for people to sensitize that yes, this is not some kind of flu that will come and go away. I think this complacency has gone into people that yes, this is a normal flu. It is not. It is a very dangerous virus. It will take away part of your function for the life. I think that those issues must be brought to people, and then they perhaps will see it more seriously.
I think that's such an important point for you to have made, and thank you so much for making that. We will keep reinforcing the point on long COVID. I'm out of time on this program. I'd like to thank you all very much for joining us.